Hi! Welcome back to another Good For You Tip of the Week. Now, in today's video, I'm discussing the 5 surprising facts about high blood pressure. What you don't know about high blood pressure can actually hurt you. Did you know that 1 in 3 Americans suffer from high blood pressure, also known as hypertension, and they're not even aware of it? So the problem is uncontrolled high blood pressure can actually increase our risk of heart disease and stroke. This is the leading cause of death in the United States today. Fortunately for us, though, this is preventable and it's treatable. So to lower your risk, make sure to check your blood pressure regularly. So the first surprising fact is increased blood pressure or high blood pressure can actually increases our chances of developing dementia. In recent studies, it has been shown that high blood pressure increases our risk of dementia, which is a loss of cognitive function. They say timing seems to matter. Some evidence suggests that having uncontrolled high blood pressure midlife, which is ages 44 to 65, creates a higher risk for us to develop dementia later on in life. So what's the takeaway message? It's never too early to start thinking about your blood pressure and making sure that it's under control. Number 2, young people can also suffer from hypertension. High blood pressure doesn't just affect the elderly. 1 in every 4 men and 1 in every 5 women between the ages of 35 and 44 are suffering from high blood pressure today. High blood pressure is the leading cause of stroke, a condition which is on the rise amongst younger people. Experts are saying that the increased risk of stroke among the younger has been linked to the rising rates of obesity, high blood pressure, and diabetes. The crazy part is these diseases are preventable and treatable. Younger people should get their blood pressure checked regularly or at least once a year. It's so convenient today. You can either do it at your doctor's office, pharmacy, I've seen them in the grocery store, or order an at-home unit. Number 3, high blood pressure usually doesn't have any symptoms. So high blood pressure is sometimes called the silent killer. That's because most people that are suffering from it don't have any symptoms like sweating or headaches. So because many people feel normal or fine, they don't think to check their blood pressure on the regular. Even if you feel normal, your health can still be at risk. So make sure you ask your doctor if you're at risk for high blood pressure. Number 4, many people with high blood pressure don't even know it. I think I've said this a few times, but it's pretty scary because did you know 11 million people in the United States are suffering from high blood pressure today and don't even know it? So a lot of these people are seeing their doctors, but they're not being diagnosed appropriately. So the CDC is working much closer with providers to make sure that these people that are hiding in plain sight are diagnosed properly so they can be managed properly. If you are diagnosed with high blood pressure, make sure to follow your treatment plan and the advice that your provider gives you. Last but definitely not least, number 5, women and minorities face a unique risk for increased high blood pressure. That's because women with high blood pressure who become pregnant are more likely to develop complications during pregnancy than those who have normal blood pressure. High blood pressure can lead to disease or disruption in the mother's kidneys and other organs, and it can cause low birth weight and early delivery. So also certain types of birth control can raise a woman's risk of high blood pressure. So it's really important if you do want to get pregnant to lower your blood pressure before you do so. Also, African Americans have an increased risk of high blood pressure amongst all other races and ethnic groups. Experts link that this is related to higher rates of obesity, diabetes, and stroke among this group. So, lifestyle changes such as reducing the amount of sodium you ingest, getting more physical activity, and reducing your stress levels can also help lower your blood pressure. What can you do today to start managing your blood pressure or preventing high blood pressure in the first place? Well, living a healthy lifestyle. What does that mean? That means make sure you're eating a healthy diet, maintaining a healthy weight, getting enough physical activity, not smoking, and limiting your alcohol consumption. Well, that's all I have for you today, fam. I hope you enjoyed this video. Hit the like button, make it a great day, and I'll see you next week.